And welcome to part two of the first annual Data and Research Roundup. We had a morning session and afternoon session, and it's exciting just to kind of launch something new. It's our 30th anniversary for CAN, right? So it's kind of a big milestone for CAN, and it's actually the 15th sort of anniversary, or it's a publication of the 15th annual CAN dashboard report. So um, it's kind of cool to try to do kind of something different and new around data. And the dashboard is it's divided up into four sections, which is the morning, and we did two in the morning, two in the afternoon. The morning session we covered sort of safety, justice, and engagement, as one section, and then we also covered a little bit about basic needs. And in the afternoon, we're focusing more on the health and economic and educational opportunity pieces. And in our dashboard, the economic and educational opportunity piece is called Achieving Our Full Potential, right? So that's an even longer title than economic and educational opportunity, but it's more descriptive so people kind of know what we'll be talking about. Um, and again, it's in our dashboard, we present data, in about 18 or 19 different indicators, and we rely a lot on the census data. And so there's like a 2 year lag between sort of the data and the data, like the current year and the data that we present in the dashboard. So keep that in mind, right? So you might be looking at 2022 or 2023 numbers. Um, so so this what we're presenting is the 2024 dashboard, right? Because we publish it. We usually talk about that dashboard in 2025. So you'll see 2022 data in this dashboard, but next month, November 12th at 10 a.m., we'll have a just kind of a dashboard release event. So if you want to see what the latest edition of the dashboard data looks like, we'll have again data that's a year kind of more current than what we might have presented this year. So I want to mark that down and make sure you're on our list so that we can um, get to the registration data, or maybe we can drop in the link to that event in the chat. And I'm joined here today by both Carlos Soto, who's our research planning and evaluation coordinator, as well as Jelena Tunstall, who is our program and operations coordinator. And and that's it. And I'm Raul Alvarez, the executive director, and that's the army of three people that is CAN. So whenever you see something happening, it's the three of us figuring out how to make it work. So very appreciative for Carlos and Jelena, who have been with us for a very long time already. I think it's my 10-year anniversary. That's what people on LinkedIn were telling me this week. Congratulations. And Carlos, I think, is 9 years, and Jelena, 8 years. So we've been a team for a pretty long time, and very grateful for that. Because again, there's a lot we can do once you have all that expertise and, internal institutional knowledge. So I'm going to hand it over to Carlos to give us a little overview of the dashboard, and then we'll get into a little bit of the data. So, Carlos, take it away.
Thanks, Raul, for the introduction. I'm Carlos Soto, Research Planning and Evaluation Coordinator for Community Advancement Network, and I'm going to be talking to you a little bit about our organization and some of the data you can find on the website. Um, and I will say that the data that we will be discussing today is from the 2024 update of the CAN Community Dashboard. We will be sharing an updated dashboard report with updated indicators that have newer data next month. So as we update the website, and if you go look at the website in the next month or two, you might see some changes and updated data. So we encourage people to check the website periodically to see if there are updated data and to see how that updated data might change the metric for the indicator that you're interested in. So the next slide will discuss our mission, and CAN is a partnership of government, nonprofit, private, and faith-based organizations, and we all leverage our mutual resources to collectively improve the social, health, educational, and economic opportunities in our community. Now, when we say it's a partnership, the next slide will show exactly how broad the variety of partners that together collaborate on this endeavor come from. So we have government partners, education, housing, health, workforce development, higher education, economic development, and collaborative and philanthropic organizations. And we all share the same goal, and we are all interested in collaborating on to improve those conditions we discussed earlier. Um, okay, so the next slide will show you what you will see when you land on the CAN website. Uh, So, uh, to visit the dashboard, you would click on that first button on the left. You can also use those buttons that you see there. The second one will allow you to subscribe to our newsletter, which has information about not just events, but relevant information, new reports, and things that are important for um, partners and stakeholders that are working in the same areas that we are. The opportunity map also helps support some of our economic mobility work by kind of shining a spotlight on areas that need extra work where there might be inequalities or disparities. And the podcast button allows you to sign up for our events calendar and weekly podcast that discusses local events or initiatives that might be relevant. And so if you click on that dashboard button, it will take you to the dashboard website, which looks like this. You can download the report on that second menu link on the top, and you can download previous reports there. So if you're interested in seeing what the dashboard report had 10 years ago and how that's changed, you can visit there. And you can see we have four main issue areas that are safety and justice, basic needs, health and justice. I mean, health and full potential. And so when you click on one of those logos, it'll take you to the indicator. I mean, it'll take you to the dashboard page that shows the current metric, what it was 5 years ago, if we're what the goal is, and if we're on track to meeting that goal or if we're making progress. So the next slide is just an overview of our uh, mm, main issue areas, right? Just the next slide is the issue areas. Okay, there it is. Uh, and together these give us kind of a fuller picture of the areas that we might be succeeding in or the areas that we might need to work on. And so what's important to take away from the CAN dashboard, some key takeaways or key considerations, if you will, are that the community-wide indicators, an indicator for Travis County or even the city of Austin, doesn't tell the whole story. So that's why it's important to disaggregate the indicators by race and ethnicity, age, sex, or any other form of subpopulation that the data allow for. And that's what the drill down section and that are available online are for and why they're so important. And so when we take a closer look by age, we see that our youth are a very diverse population. So addressing racial inequality is critical for the future of our community. It's a long-term investment. So demographic shifts are also affecting economic indicators as much or more as efforts to address persistent changes. So we'll take a closer look at that when we look at a little bit of demographic data. But the fourth thing to consider is that we're still looking for changes to pandemic era shifts in demographics and outcomes. Uh, we can still see it in the data, and the effects of the pandemic are still being felt by the people who are reflected in those data. So the next slide shows us what we were mentioning about demographic shifts. If you look at the under 18 population, over 60% can be considered people of color, whether they're Asian, Black, Hispanic, or multiracial. But when you look at the population that's 65 and over, it's almost flipped, right? Over 60% of the population there is white, alone, non-Hispanic. And so that's part of like a big change, a significant change that's occurring in our community. And we know that different people of different ages have different needs, and people from different cultures have different needs at different ages. So those are all things to consider while we listen to the presentations from the folks that have agreed to volunteer. So the next slide shows us child poverty. And poverty for children is greater than adult poverty. And then when we look at disaggregated child poverty, we see that it's not impacting all groups in the same way. There are some groups that are affected, and some children that live in households with poverty level income uh, from that are more likely to be from certain groups. And so if we take a look at the next slide, we also see that there are other changes occurring geographically. About 21% of people living in the five-county MSA were low income in 2022, and that's defined as people who live in a household with twice the poverty level. So that would be 59,356 for a family of four with two parents and two kids, and 47,156 for a family of three with one adult and two children. And from 2012 to 2022, the total MSA grew by over 500,000 people. But over the same time period, the number of low-income residents declined by about 87,000, which is a 15% reduction over the same time period. So that's for the MSA, but if we take a closer geographical look, we see that the movement isn't the same in the counties or that make up the five county MSA. And data for Caldwell County is not available because it doesn't meet the reliability thresholds for the Census Bureau to share them. So that's why you only see four counties here. But you can see the percent change for the low income population from 2012 to 2022 for Travis County was 25%, but Bastrop gained 53% in terms of low income population. So uh, there's a the shifts, the demographic shifts are not the same in the different parts of the MSA. So finally, for me, this map shows concentrations of low-income population per census tract, and light blue shows up to almost a third, meaning that if a third of the population of that census tract is low income, it would be light blue. The medium blue shows census tracts where the low income population makes up 31% to 50% of the population, and dark blue are census tracts where over half of the population live in low income live with incomes that are low income. And to take a deeper dive on some specific indicators, Raul will continue. Thanks, Raul.
Thank you, Carlos, for kind of giving us kind of a landscape there of sort of how we look at things and what's kind of happening, in our community to think about as we look at some of the data. And so again, here are four sort of sections of the dashboard, and we're going to be looking at sort of in this short presentation the We Are Healthy and Achieving Our Full Potential sections, and hopefully maybe showing you some of the drill down if I can go quick enough. But and just a little bit more about the structure of the dashboard. I think the very first year might have been the only year where we presented like 1 year's worth of data, um, but very quickly we heard that it's very difficult to glean anything from 1 year's worth of data, right? If you're looking at it in a vacuum, right? So I think very early on in the history of the dashboard, we ended up using a 5 year baseline to compare to the most recent data, just to see, kind of what's the trend, and then I think later a target was added, and just to see, we might have a good trend or a bad trend, but are we gonna be able to meet our community goals? And so I think that's part of what you see here in the dashboard, and because like in your car dashboard, right? If there's a yellow light or a red light that pops up, you kind of pay attention to it, or else beware of what might be coming, right? If you don't pay attention to it. And so here you see in the health side, we in terms of health insurance, kind of where we are, because of a lot of very concerted efforts to address that, need in our community. And of course, there's concerns about that, policy wise, in terms of resources and policies that may be affecting that. Um, uh, People reporting poor mental health is one of the ones that has increased the most during this 5 year period. Um, and then obesity is much higher than our target, but kind of remain relatively, at least for those 2 years we're comparing here. And smoking, again, we've made some gains there because of a lot of really great advocacy and policy work. And then air quality, um, we're not doing so great in that. We had a pretty bad year that year, but it's something to keep an eye on because it seemed a little anomalous. But those are the kind of things that you, you again, that the dashboard makes you think about, because um, you want to see if it's a trend, maybe, or just a blip in the data. So here's a little something where, again, we've done well over the years. If you look at 10 to 15 years, just how much better we are in terms of health insurance access. And I think partly what we try to do, in addition to kind of looking at multiple years, is also comparing to other jurisdictions to see kind of how we do in Travis County and City of Austin compares to other jurisdictions. And in the dashboard, where we can access disaggregated data, then we try to share that as well. And this is the kind of sort of breakdown by race and ethnicity for people who are uninsured. And you see that, compared to sort of Asians and whites who have, the lowest rates of people who are uninsured, Hispanics have a much greater rate, almost twice as much, or twice as much. Yeah. And and here's another one, obesity, that I think it's addressed in some of our kind of health improvement reports. And you see kind of what's happening with that over time. Not a lot of movement. Again, we're looking at Travis County as the red. So it kind of goes up and down, but it's kind of like stayed close to that 25 to 30% range. Um, and here is sort of what that looks like in terms of race and ethnicity. And sometimes, again, this is from the BRFSS, you see the source there. And sometimes if the reliability on certain racial and ethnic groups is not good enough, then they don't publish the data. So that's why you see, I think in 2022, that we don't have for Black community members. And that's just one. I think hopefully we'll have time to do a little drill down. But the Achieving Our Full Potential, again, which is where we have our economic and educational indicators. We have kindergarten readiness, high school graduation, and post-secondary success on the education side. And an unemployment rate is what we track on the economic side. And because we don't have a lot of economic data, we are actually planning to publish a economic mobility report. Hopefully, if we can get it done in time with this year's dashboard, so that'll include more economic data since we don't have a lot of space to kind of flood, this section with a lot more. Um, but you see again here, in terms of kindergarten readiness, where we are. And this is kind of old data because the indicator or the survey instrument used to track kindergarten readiness changed, right? So now we have, I think, 4 years worth of data, and in the next dashboard, you'll actually see data that's I don't remember to what year in particular, but I think it's at least 4 years worth of data, so it can be updated again. High school graduation, you see, we're doing it stayed the same, from those in that 5 year period, roughly unchanged. And then where we've seen a lot of growth in the 5 year period is in post-secondary success. You see people who graduated, from with a degree or certificate of some kind. And the one red trend that we see is in unemployment. And it's I don't know that it should be worse because it's we exceeded the target, but it's worse than it was in 2019. But we're below the target of 3.5. And again, just a couple of slides just to see kind of how we're doing in terms of high school graduation. You see, kind of we've been steady at 90 and 91%. In Central Texas, we're only kind of slightly higher than the state. And then this is what it looks like. This is again high school graduation by race and ethnicity. You definitely see the education or achievement gaps narrowing, but there still is a bit of a gap, especially when you look at, Asian and white community members, right, or students compared to Black and Hispanic students. And then again, it's kind of a similar thing we do, right, with post-secondary success. It definitely has been going up during this 5 year period. And then, but you still kind of do see the gap in outcomes for this educational outcome. And because you see Hispanic and African Americans, around that 45% and or lower rate, whereas Asians and whites are above kind of 65%. So pretty significant gap there. And let me check my watch to see if. Well, I think we'll end it there. We're hoping to dive into the dashboard or a drill down of sorts, but we'll stop there for questions. I'm sure there were. We threw a lot at you really fast, and that's just again, on 4 indicators in 2 sections. Um, any questions, or I haven't been able to look at the chat right. It's just
Raul, I'm wondering if you have any connections with Excelencia in Education. I have been following them for quite a few years, and I have seen an upward trend of like high school completion, including they follow undergraduate and also graduate progress for the Latin Hispanic community. And so on a national level, I think that, some areas have improved dramatically for that undergraduate and post high school education. But and I say our because I'm an immigrant born and raised in Guatemala, our pay is still, subpar compared to the white folks doing the same work with the same type of degrees, and in some Asian populations as well. So I don't know if you're familiar with them, but I will send you some of their reports that
yeah, please do. Yeah, no, I'm familiar with them. Before 10 years at CAN, I was 10 years at AISD, and definitely definitely followed the work that they were doing, and continue to do, right. So
right.
but I do think, in terms of, again, kind of what are the solutions, I guess is what you're looking at is, right? If we see these achievement gaps, then what are the best practices, or, who's having success, right? In terms of uh, addressing those gaps or challenges. So I appreciate you mentioning that. That's a great, great organization. Um, and then I think Dan asked about um, people moving, right? Is it, is I don't know if he was responding to the maps about income.
Somebody else asked about it. So somebody
Okay.
else asked if the shift is because there are fewer people in poverty or because their incomes increased, or is it that low income people have chosen to leave Austin? And there were a
Yeah, and
couple responses. Uh,
I think I mean, again, the things that I think that we can glean. One is obviously it could be that people are earning more money, right? And they don't qualify as low income anymore. But I think we had this question earlier today as well.
yes,
And
and
let me go back to that
we
slide.
did have a response from Dan that says that ACS geographic mobility data show that people in poverty are not necessarily leaving Travis County. So it might be that their incomes have increased and pushed them, they no longer qualify as being in poverty. And tables from the ACS tables B07412 and B07012 might be helpful for people that are into that kind of thing.
And I think this is the slide that generated, I think
Right.
that question is where you see again that Travis County has about what 98,000 less, individuals, right, who are low income or meet that criteria, but we can only account for a few of those in the surrounding counties looking at these two time periods, right? I mean, that's the other thing to kind of
I think
think about.
Lila has her hand
Yeah.
up.
I just want to add really quickly on this point that it is very hard, right, to understand outmigration. Now, we typically get some information on in-migration, but outmigration is a little bit difficult because basically you'd have to look at multiple areas to understand how that's changing. But one of the things that we've noticed is when we look at people who are moving into Austin, into the Austin region, or even into just Austin or Travis County. What we're seeing is that people are moving from out of state. They tend to have higher incomes, higher educational attainment. If people are moving from other parts of Texas, they tend to have lower incomes and lower educational attainment relative to Austin residents. The other thing that I'll mention is that even if you don't see a lot of budge in the poverty numbers in Travis County, one of the things to consider is that it takes means to move. And so some people who may be in affordable housing or income restricted housing may not have the benefit to move somewhere else or gain an additional benefit, or may not have the means. And so sometimes what you see is that the movement is really happening in the middle of the income brackets when there is sort of affordability pressures to move.
Thank you, Dr. Valencia. Um, we have a question in the chat if and anybody would like to try to
Oh,
answer that, and then Avez, and then we'll move on to the next presentation. Is that okay, Raul?
yeah, I don't know what the question is in the chat. Yeah.
Okay. Yeah, go ahead, Avez.
I'll just make a quick, honestly, building what Dr. Valencia was saying. I just did want to mention regarding poverty rate as well. Nationwide, it has also dropped as well. So that's part of it. We're following the nationwide trend. Pre-pandemic, it had dropped significantly, actually, nationwide, and we were following that trend. Then poverty really spiked during the pandemic and following years. But the 2023 national data also shows that it's now trending down again. So partially also just nationwide poverty is falling, which is why for Austin it's falling as well. We're in trend with the rest of the nation as well. Just wanted to point that out.
Thank you, Avez. Yes, from the chat. In general, do any local elected officials use CAN's data that could benefit the initiatives for education and healthcare specifically? I know there is a JSC joint subcommittee that includes AISD, CO, City of Austin, and Travis County. It would be a benefit for them to see these important recent outcomes of data.
Yeah, I mean, I think, the city and the county and school district are basically founding members of CAN, right? So, and usually, we have two city council members and two commissioners, and one AISD trustee, right, on the CAN dashboard. I mean, on the CAN board. And so, and I know Councilmember Fuentes, Councilmember Velasquez, and Harper, Councilmember Harper Madison have all served on the board. I may be missing one there. And our current trustee is Trustee De Urioste, right now, who's an at-large trustee. And on the county side, our current chair is Jeff Trevelyan, and also Andy Brown is the sort of the second rep from County Judge Andy Brown, right, from the county. So I think most council members, some of the new ones, again, I may not have kind of visited with now that we have a much larger council, getting in to meet with all of the members, but I think they're pretty familiar with the CAN dashboard as a resource. And I think, there's just kind of a change every year in terms of who's representing these jurisdictions, right? So, but thanks for that question. I do think, again, what the forum that CAN provides is to have people who do transportation and health and education all coming together to try to talk about some of these issues, right? Versus the health people talking about the health stuff on their own, and the education people talking about the education matters on their own, and the transportation people kind of talking about it on their own, because there are a lot of linkages across issue areas and indicators. And so we have a retreat next month. So we're going to be having that kind of conversation about what is the data telling us in our new dashboard that we'll publish in a few weeks. So thank you all for the information and the questions. Again, very quick presentation. Usually we do an hour on this, but part of what we're trying to do here is kind of share a lot about what's going on, and then so that you can, once you know or whatever you're interested in, you can dig in and go reach out to folks. You know what I mean? More directly, or explore websites for these organizations, et cetera. Because we know about these resources, but not everyone does. So we want others in the community to know that all this data and research is out there, and how it can inform your work and things you're trying to impact. So thank you for that. Very insightful questions, because I know we moved really, really fast. But we're gonna transition to our first presentation, or at least our first presentation that is at CAN's presentation, which is an overview of 211 data and the 211 dashboard. So we'll welcome Dan Brown, who's Data and Evaluation Manager with the United Way, who again is one of the original founding members of CAN. So thank you all for your support for 30 plus years. So thank you so much. And thanks, Dan and Alison, who present a little later, for supporting us today. So.
All right, well, thanks, Raul. I appreciate it. I'm going to go ahead and share my screen here. Over there. Okay. So get into presentation mode here. There we go. Well, greetings, everyone. I'm Dan Brown. I'm a data and evaluation manager for United Way for Greater Austin. And I wanted to talk to you all today about 211 data and give you an overview of the dashboard. And if I have time, maybe dive into a particular topic area related to 211 data. So just as far as a overview of what 211 is and where the data comes from, 211, as I'm sure many of you know, is essentially a social service referral hotline that's available 24/7, 365 where people can call or text or chat to if they have needs for various services, and 211 connects them with those services, things like housing, food, healthcare, etc. And so 211 is a service of the Texas Health and Human Services Commission. And there's also the Texas Information and Referral Network, or TURN, that oversees the 211 agencies and is part of a national initiative to provide this information to communities. The United Way for Greater Austin runs the navigation center that answers the 211 calls. And primarily our service area is Central Texas. And the data from those calls is housed in a data system that is managed by HHS called Community OS. And so each month we download the data from there and incorporate it into our own database at United Way, and sort of format it in such a way that it can be presented in and visualized in a way that's digestible to the general public. And so we put out a dashboard that gets updated each month. And in addition to that, we also do reporting and analysis by request of that data if there's something that's not readily available on the dashboard. So the next thing I want to do is give you all a quick tour of that dashboard. And I'm going to switch now to, this is the United Way website, and just show you how to get there to the dashboard. So you get to the website, you go to our work, there's impact. And if you scroll down on the impact page, you'll see various reports and topics, and here is a link to the dashboard. And I'll also point out there's a report that we recently put out on unmet needs from 211 calls, and hopefully I'll have time to touch on that later. So let's go to the dashboard. So the landing page essentially gives you three main tabs you can go to: request by location, needs, and requests over time. So I'll just kind of run through those. So this first tab, and you can see now the tabs are repeated on the top. And along the top here, there are filters. And when you select anything from one of these filters, it rolls through into the other tabs. So the date range, our data does go back to 2019, January of 2019, and then goes all the way through to whatever the most recent month is, which in this case is September of 25. And we default the slider, the date slider, to be 13 months. So you see a year prior plus the September of the last year, so you can compare those 2 months. If I drop down the county filter, you'll see 10 counties there, which represent the 10 county service area that United Way serves. And so by default, all of those counties are visible. There's also all the cities within those counties and zip codes. So, and then next we have categories. So here's where we've had to do a certain amount of work with the data to decide, which categories to put things in essentially. And I'll get into a bit more detail on that. We created categories and subcategories, and these are based on the Ayers taxonomy system. So there's 5 levels of taxonomy. I'm not sure how much detail I want to get into this. It gets really kind of in the weeds. But so for instance, if your basic need is for healthcare, that would be a level 1, the most broad level of taxonomy. But maybe within that, So let's say the person who called, what they were looking for is oral cancer screening, for instance. So the main need there is healthcare. What type of healthcare? Well, it's a health screening diagnostic service. What type of health screening? Well, it's a disease disability specific screening or diagnosis. Which type of screening? It's a cancer detection. And which type of cancer? It's oral cancer, right? So those are sort of the 5 levels of taxonomy. And we have to choose, at least for the purpose of our dashboard, which one we're going to display. We want to give enough detail and not too much detail. And also, if you're aggregating these things, you want it to be doable. So, long way of saying, here's our main categories. And then in this other box here, in the subcategory, you can also use essentially a wildcard, where you can type in any word you want, and it's going to come up with a result. So, for instance, if I were to type in, I'm going to eliminate everything, but I'm only going to show food as a category. So now the map has and all the numbers have changed. So we're seeing how many requests by county for food and by city. And if I were to click on, let's say, just Travis County, now it's going to show me just those cities within Travis County, and it's going to also limit the map to Travis County. And in order to clear this kind of, if I pick a filter, essentially, so there's filters on the top, but when I click on something down here, it acts as a filter as well. So to clear this type of filter, I usually just refresh the browser. Oh, now it's taking me all the way back here. Let me get back to where I was. Okay. However, if I were to type food into the wildcard, it acts differently. So it's going to come up with, actually, I think in the needs tab is where this shows up better. I'm going to wait on that one. Let me just take that out for now. All right, so what else do I want to show you here? I think that's kind of a good description of the filters and showing requests by location. And I'm going to move on to the needs tab. Okay. So here's where, essentially if I were to click on food, the subcategories now are rolling up the things that are specifically food, whereas previously it was showing all kinds of subcategories by whichever one was highest. Okay, and I think now that I'm in the website, it's booting me back here. Somehow when I go in a different way, it doesn't act like that. Anyway, but if I were to type, get back to my needs tab, type food in here, we're now seeing, because it's a wildcard, it's really looking for anything where the word food is in the field. And so now we're seeing, for instance, pet food, which is not really in the food category. It's probably in one of these, like individual and family life, I'm guessing is where that's coming from. So the wildcard can be useful if you're looking for something specific and you're not sure which category it's going to be in. Okay. Another thing you can do is download the data. So whatever's being displayed, if you're to click this download and then say choose crosstab, then you can choose by category or by subcategory or by zip code. So essentially, you have options based on what's showing, and then you can download that and it'll give you a spreadsheet of the data that sort of underlies what you're seeing here on the dashboard. Okay. Let's see what else I want to tell you. I'll move on to requests over time, make sure I get all my filters out of the way. So another feature of the dashboard is that you can look at requests over time. And again, whatever filter you apply to this, if you're curious just about healthcare requests or housing requests, this line graph will adjust to show you what it is that you're looking for. So, and I guess another thing to emphasize is there's a difference between requests and needs. So, a request is essentially a call, somebody or an interaction, whether it's a call or a chat or a text, somebody has reached out, and we count that as one request. But within that request, there may be multiple needs. They may have a need for housing and for food assistance and for something else. So when you're looking at the dashboard, I'd say it's important to just be aware of whether you're looking at requests or needs in terms of what the numbers are showing you. So this tab is called requests over time. So this is really just interactions. And you can see on average, it's, 6, 7, 8,000 calls a month. And at the end of, well, this is 13 months, but about 95,000. So, close to 100,000 calls per month that we're tracking here. Okay. So that essentially is a snapshot of the dashboard. I think I covered everything I wanted to about that. And I see I've got plenty of time left, so I'm going to go back and I want to drill down into a specific topic. If we go back to the needs tab, you can see that food, housing, healthcare, those are really the top needs that get expressed over time. And I want to go into one of those topics specifically. So let me get my presentation back up. I wanted to focus in on a particular topic, and we had reached out to the community to find out what people wanted to know most about what 211 data can tell us. And a couple of the things that are not necessarily visible on the dashboard are referrals, like which agencies are we referring to the most, and then also which needs that are being expressed in those 211 calls are not being met. That there's no resource, or for whatever reason, that caller's need is not being met. So I wanted to focus in on that topic. There's various reasons why those needs are unmet. And I'll say on average, there's about 4,000 unmet needs per year. That's about 3% of all needs go unmet. And this was during the time period of, again, 2019 through 2024. So just that 5-year period. And this table here is showing us what are the reasons why those needs are unmet. The biggest reason being that there just is no service available for whatever that need was. Another reason is that the client refused the referral, and there's some reasons for that I'll cover in a second. Or the client is not eligible for that particular resource. Sometimes the call is just disconnected. There may be a lack of funding for the service they need. They may have transportation barriers or other logistical barriers like that. Maybe the resource is sort of a seasonal program that's not always available. But generally speaking, it's because there just wasn't a resource, a refusal, or ineligibility, or the big three. And you might wonder, why would somebody refuse a referral? Well, based on feedback we've gotten from our call center agents, essentially it could be that they had difficulty accessing the resource due to high demand for that resource. Also could be that the amount of assistance available was just not worth the effort to go after it. The funding was just not very much. It wasn't going to make a dent in their need to pay the rent or whatever their need was. They've tried to get assistance from the agency they're being referred to in the past and did not have success with that for one reason or another. So they declined to try that again. So those are the, some of the reasons that we hear frequently about why someone would refuse a referral. Okay. In this slide, I'm just giving essentially, this is all the needs expressed over that whole time period, that 5-year time period. These are not unmet needs. These are just all needs, whether they're met or not. Just to give you sort of a baseline of what the needs are. So food, number one need, housing and shelter, healthcare, utilities, it kind of goes down from there. But really the big three are food, housing, and healthcare. Okay, the next slide, I'm going to show you which needs are unmet most frequently. So that tells a slightly different story. Housing is far and above the rest in terms of people not being able to get their housing need met, and followed by transportation, which was not one of the highest needs overall, but in terms of needs that are unmet, it's pretty high, relatively speaking. And then healthcare, you see food is actually, while food was in the previous slide, food is number one in terms of needs. In terms of unmet needs, it's a little bit, it's further down in the hierarchy of unmet needs. There's just more resources for food than for housing and shelter. So, and then since housing was the largest of the unmet needs, I drilled down a little bit further into that. And so now we're looking at housing is what we can call one of our major categories. So within housing, there's several subcategories, and that's what we're looking at right now on this slide. So the big three there is need for motel bill payment assistance, rent payment assistance, and homeless shelters. So those are the, within housing, those are the three big ones in terms of needs that are going unmet. At least, through our 211 call data. We also, I looked at it by county in terms of unmet needs. So, uh, overall, I think the average was, I said 3% of needs go unmet, but it varies by county. And so, this is kind of intuitive that Travis County being a major metropolitan area with Austin is further down the list in terms of unmet needs because there's a lot of resources here. But some of the more outlying counties have a higher percentage of unmet needs just because, again, fewer resources. So Llano, Fayette, and et cetera. Okay. And another thing that we can do with this data is to map where needs or unmet needs are happening the most. And so we do get the zip code of the caller. So we do have that data and we can use it to map out all these different factors that I've been showing you. So this map is showing unmet needs. And even though the percentage of needs is lower in Travis County than the outlying areas, the sheer numbers, of course, are bigger just because it's a bigger population. So what we're looking at here is counts and not percents. I could also do it by percentage, but in this case, I used counts. So the darker colors essentially are showing you the highest concentrations of unmet needs in general, not for any particular category, but just all of them. And then the lighter the colors by zip code, the fewer unmet needs there were. But I will say that if I were just mapping needs as opposed like all needs as opposed to unmet needs, the map would look very similar just because of the numbers being so large in the urban core. Okay. And another thing we can do is look at needs over time, or in this case, this is actually showing the unmet needs. which can be interesting. So, over that 5-year period, of course, housing is the largest of the unmet needs. And, we see a spike in 2023. It sort of is trending up all the way from 2020, and hit its peak at 2023 and then down in 2024. So we'll have to see by the end of 2025 where that trend goes. But that's what we're seeing so far in this data.
Hey Dan, I had a question on the zip code one. It's like, do you know which were the zip codes that has the greatest unmet needs, I guess? Is that something you can?
Well, that's something that I could certainly, it'd probably be better shown in a table, I suppose. So it could just be listed
Yeah.
in hierarchical form. I mean, on the map, I don't know how well you can see some of these zip codes. But yeah, I mean, 78728, 60535423, those 78741 and 4445, that sort of southeast
Oh, I see.
area.
Oh, and I see Alison said that's in the written report or the published report. So you can, yeah, I
Right.
think Alison shared
Okay.
shared the link to the report. So if you want to look at
Yeah.
the zip
Uh,
codes that light up the most or the darkest, then that
right.
might be a good option.
Yeah, and the that report is available on the website too, the same page where the dashboard is. So, okay. So that is what I wanted to talk to you all about. Just give you that overview of 211 data, our dashboard, and then just focus in on that topic area. So I'm gonna
Yeah,
stop.
thank you. That was a great information. And anybody have questions? Like I said, I always have questions, but I won't lead with questions this time. I know you answered a few that were in the chat already. Um, but um, but I'm just grateful. Again, I remember Dan when you started doing this. It was that first year of the pandemic, and you were actually with Children's Optimal Health at the time. And I think all of us were calling United Way about their 211 call data. And there wasn't really like a report or a data set, right, that could be shared, right? And so I think through, you know, United Way's kind of generosity in sharing data, and obviously because Children's Optimal Health and CAN and others, city, county are trusted partners, right? I think that was so useful at that time, right? In looking at and what were the needs at that time? Well, actually, it's not so different from what you said. It was the housing, right? Because of evictions and employment, right? People were unemployed, didn't have income. So then you had health insurance needs, utility assistance, housing assistance, a variety of public safety, right, concerns. And then I know it was a heavy lift to figure out how to map all this stuff and report out on all this stuff. So I know Alison and Dan and your teams were very integral in getting that set up. But now we have this tremendous, I think, resource, right? That where you all are sharing this data on a regular basis, just like we had on the sort of the food dashboard, right? That the Central Health Food Bank shared, where same thing during the pandemic, right? It's like, well, where is the food need, right? And there wasn't like a public facing sort of food dashboard, So I'm very thankful for y'all for sharing this information because it's easier said than done to share, this such a vast amount of information in a way that you can make sense of it. So I appreciate it. Just like Dr. Valencia's community profile builder, it's like, because again, we all as data and research people get asked, can you show it to us this way? And can you show it to us that way? And instead of it becoming like this impossible exercise that you're throwing on top of somebody's already busy profile, right? Or um, of work, right? Then you actually have it available, and maybe with a few tweaks, you can answer some of these questions instead of like this heavy lift where people have to stay up, late at night and on weekends working on this stuff. So I'm pretty very grateful to y'all for having created that and also for sharing it. And Because I'm sure, again, now that you have the 211 call data, then people ask the follow-up questions, which is, okay, and what if that need is unmet, right? And so I know that's why you published the report, because it's like, what's the most common question that we get? And I think Dr. Valencia addressed that too in her presentation, which is, well, let's just, if we know that's what people want to know, maybe we should just kind of give it to them, right? And so thank you for being kind of responsive in that way, all of you as well, because we all want the data to be used for good, right? Not just that we have data, but that it can be shared in a way that can lead to action and policy change and advocacy, et cetera. So I will, any other follow-up questions just based on that? All right. Well, thank you, Dan, so much. And Alison is up next. So continued thanks to United Way. And so I'm excited to hear this one too, because it's another one of those where I didn't know we had a early childhood data hub, right? So I want to welcome Alison Bentley, who's been on the dashboard steering committee, I think longer than I've been ED. I think, Alison, I could be wrong, but she's the VP of data and evaluation. And let me stop sharing so that you can share. But thank you, Alison, for all your support all these years, and for, again, the amazing and impactful work you all do at United Way.
Thank you. Yeah, thanks for having us. I'm not sure I'm able to share my screen. Oh, no, I am. Sorry. It's been a while since I used Zoom, and apparently you forget. So
well, thank
apologies.
you for working through it. Yeah.
Can you all see my screen? Yes. Awesome. Yeah, I'm here today to talk a little bit about the Early Childhood Data Hub. It's still very much in development, but it really originated out of a lot of the things we've already talked to today. As many of you know, we are the early childhood backbone in our community, where we've been leading this early childhood effort for, gosh, longer than I've been at United Way. And as Carlos said, I've been here longer than him. I've been at United Way just about 13 years. But we've been tracking data around community trends in early childhood. So again, kind of mapping where children in poverty are living, mapping how many kids that is, what percentage of kids are living in poverty, what is the racial makeup of those kids that are living in poverty, what's the cost of childcare, and then kind of our coalition indicators, which is everything from kind of the school readiness data that's also on the CAN dashboard, but also data on percentage of childcare centers in Travis County that are quality rated, how many kids that are low income access care at those high quality centers. So there's so much data that we've been tracking for 10, 15 years, but that really just sits at United Way. And similar to many of you, we continuously get data requests of, hey, we're writing a needs assessment. Can you provide me XYZ? And so I caught myself continuously just kind of creating documents to share with people. And similarly with why, when I came on board, I kept saying, hey, we need to get our 201 data out. We need to get our 201 data out and make it publicly available, which, yay, we finally achieved. A similar kind of process for us is to get this early childhood data out so that other people can access it. So the idea, like I said, we're still at the very beginning of this, but the idea is that we have a centralized data hub, a website that everybody can access, where we have local data. It's primarily going to be focused on Williamson County and Travis County, with some data at the 5-county MSA area if it's easily accessible. We'll have this public data, thinking about Census Bureau data, but also a lot of community data that we'll be getting directly from partners. We work closely with Workforce Solutions to get data on childcare subsidies. We work closely with home visiting and parent education providers to get their data. And so we have lots of data that spans different levels that we really want to get out there in real time track trends across time. So not just having the most recent data, but can we compare the cost of childcare from 10 years ago to today, and making it really easily available. We want it at different geographic zones if available. So think about census tract or zip code if available, but a lot of data might just be available at the county level. Thinking about, cost of childcare, for example. We really want this data to be used for evidence and data-based decision making. We use a lot of this data at our coalition tables, but that's about it. It's not, it doesn't necessarily get into the hands of other nonprofits making decisions about their programming. It's not getting in the hands of potentially decision-making makers. Sometimes it has at the county and the city because we're so connected through our coalition work. But again, we want to make sure that we aren't gatekeepers of this data, but that anybody who wants to use it can. And we'll be building it in a way where, similar to our 211 dashboards, there's downloadable reports that people can have or visuals that can easily be downloaded. Our plan is to really have it as a community engagement tool, so having discussions around it with community members and kind of monitoring our progress across time. We are very much in the initial stages, not keep saying this, I hope we were further along by this time when Raul and Carlos asked me to do this months ago, but for a variety of reasons, which I'll get into, we're not quite as far as we'd hoped, but we are co-designing this with our community, so our coalition members have been really involved, as well as kind of our networks of other tables that we sit at. Our goal is to not reinvent the wheel. So we are planning to embed links or link to existing dashboards. So again, we'll be linking to CAN and the awesome resources that the City of Austin has available. We know March of Dimes has great resources. Texans Care for Children has child-specific dashboards. So the idea is, hey, we want to bring it all together because I have spent 10 years knowing where this data lives. Somebody who might be new to an organization might not know where all this data around early childhood lives. And we want to use our resources to visualize and pull together data that is not otherwise available or isn't easily visualized. And it'll be iterative. The idea is to add resources over time as we get feedback of what else is needed, as we have capacity. These are kind of the buckets we have already or are going to be creating data in. And so demographics, which again, trying to understand who are the kids. And when I say kids, we're really focused on early childhood. So this is kids under the age of 6 or under the age of 5, depending on what data is available. So looking at race and ethnicity, looking at their economic stability. So really looking at poverty, rents and housing costs, median family income, cost of childcare. Our school readiness data is kind of the North Star that we're looking at. It's like, this is the outcome we're focused on, but really making sure we have that data readily accessible for our community. Maternal and infant health, so thinking about prenatal care and birth outcomes. Child health, so developmental screeners, vaccinations, and maltreatment rates. Family support, so our parent education and home visiting data. Our early learning and childcare data, so this is where quality childcare, teacher education, and wages come in. And this is probably the part that will be built out first. And part of the reason why we're a little derailed from getting this off the ground. So I'll go into more detail about that in just a second. And then we've been tracking investments by the city and county for decades, and how much is invested. And so that's the data we have that we want to keep putting out there and probably build on it by seeing, hey, can we try to piece together philanthropic dollars invested and state dollars invested, and what would that look like? And all of this data kind of, our coalition dashboard data is going to be going into this data, but also informing those coalition dashboards. So an example of something that we have created, many of you know that during COVID, we kept getting asked, hey, what's happening to childcare? Childcare centers are closing left and right. And that hasn't really ended. And thankfully, the state has started to put out data on provider operations and what providers are open and closed, and then which have permanently closed. But it's not an easy data pull because it's published every month, and it's not, it takes quite a while to clean the data and put it out. But this is for the first time data we've been able to turn around and say, hey, look, in our area, so this is mainly focused on Travis and Williamson County, we've had 32 providers closed this year alone. Now, most of those, a lot of those are home-based providers, which are a little bit more volatile, but you know, you can see, this isn't the interactive, this is just a screenshot of it, but we're able to go by operation type and look at our our center-based providers, and there's been through July 8 home-based providers or 8 centers that have closed, which is a significant amount. The next step for this data is we're planning on getting year-by-year closures. So we have some understanding, since it was published in 2020, you know, how many centers have closed by year. We are, you know, mapping this data again to try and understand where in our community is this really impacting. And so this is kind of a start of what we're doing. We have started visualizing a lot of the data we're already doing, but we're still in the process and nothing is public yet. And part of our derailment is because we have been able to get funding to do a childcare landscape survey for the first time since 2018. As many of you know, we were lucky enough in Travis County that we passed a tax rate election last year to provide more money for quality childcare and after school time. And with that, when we were kind of leading that effort, we kept getting simple questions that you think we'd be able to answer, like, hey, how many sites are served in childcare? And we're like, we don't know. We do not know. We can tell you license capacity, but we actually don't even know what percentage of license capacity most people serve. We know it's not 100, we know it's not 90, but we don't actually have a number. And so we are working on a survey to kind of have this community profile. You know, I'm not going to go through all these details, but the idea is really, you know, increased transparency around childcare. This will be a big part of our data hub, where we want to have this type of data by zip code if we have large enough sample sizes, but at least by regions if we don't. And these are kind of, you know, indicators that you would think we could easily get, but we actually haven't had any kind of data since 2018 when we last did the survey at United Way. So simple information about who's served in childcare. Are they having a hard time filling their seats? Does that differ by age group? What's their weight? What staffing and qualifications like of people working? What about wages? We have no idea truly what wages are by quality, by you know, county, by area, zip code of Travis County. Tuition costs. We kind of get the market rate survey that the state and UT do, but that, again, we're trying to understand, is that, how has that changed? We also know from a lot of our providers, they don't necessarily see it, that that's truly reflective of their costs. So we're trying to interested to see what we get from our survey and how it does compare to the market rate survey that the state does. What are the operational costs? And then kind of successes, needs, and challenges of childcare providers. And so we are doing this for both home-based and licensed centers in Travis County. We'll be we have, part of what's been taking so long, we are working with providers and actually getting them involved in helping us craft these questions. And really the idea is that this will be some of the first things that we build out through our data hub and get out back to the community for folks to use. So I know I shared questions, and I know there are questions in the chat.
Alison, there were a couple of questions in the chat. Yeah, one was probably about what you were just talking about. What is the source of your provider data, right? And then, and then a different question.
So for the opening and closing data, we actually are merging 2 data files. The state has 2 data portals that they provide data on. One of them is the daily operation or monthly operation of centers or providers, And then they have kind of the front portal of where individuals can go search for care. And so we kind of take both of those together and merge that on the back end to get some additional data in terms of operation hours and things like that. But really, it's HHS where we're getting this provider data from. And then for the survey, we'll be getting it directly from our directors and home-based providers and owners. So that's where we're hoping to get a lot of data that we haven't been able to track for years. But the open-closed data is going to be from the state.
Yeah, and I think Sean was asking, I know you showed a slide where you showed like centers that were closing, but I think Sean was asking, do you have like a similar slide for centers that are opening?
Yeah, well, so it's actually interesting that you asked that, because that's kind of our next step on that dashboard, because that was my whole first thing. I'm like, well, and what we're trying to do too is, now that we've mapped it, we want to work with our program staff to say, is this actually a legit closure that we need to include? Because what has happened in the past is a center closes because they change ownership. So by licensing standards, they have to actually close that center. But in terms of what it means for families, there's no closure. It just opens up under a different licensing number. There's continuity of care. And so in terms of like what that actually means for our community, we haven't lost it, right? And so as we are kind of mapping this, that's one of the things we'll be working with our program staff on, and with with our workforce solutions folks and potentially people at licensing at the state if we need additional support, is to understand, is this a legitimate closure? And then the second piece to add to that, is there a center, if it is a legit closure, is there a center opening back up in that space? Because that's happened a lot too. There's been a lot of, you know, I see the YMCA on this call. There was a lot of closure of, was it extended cares, and then it merged into like the YMCA. So those look like closures, but actually they weren't, right? They just kind of transferred ownership and changed. So those are types of things that we're trying to figure out next with our dashboards to truly understand like the net loss for the community. This will be easier for our licensed centers, school age and before and after school care. It's going to be trickier for home-based providers. So there might be kind of a, because there's so much more fluctuation there. So more to come, but that is kind of version 2 of that. So as we kind of launch this and make it public, I'm hoping that that will be kind of another series of that dashboard, is that we'll have closures and then openings and go from there.
Yeah, from a policy standpoint, because if we're able to say that, you know, we've lost X number of, you know, X amount of capacity over the last 12 to 18 months, then we could formulate arguments for, you know, other sources of support or so.
Yep. No, and our hope is to go back to, so that the state did publish data all the way back to 2020. The thing is they don't make it easy for you. It's literally published in 1 month increments. So for each year, you have to download 12 files and then clean them and see where the duplication happens and what closed, what opened. So it's great from like a monthly standpoint, because now that we're up to date in it, we can keep up to date on each file and figure it out each month. But going back is going to be a little bit of a nightmare. But it's on our radar because we do want to have an understanding of, again, through COVID and beyond, what was the rate of closure each year, and where are we going now, or where are we at now with this rate of closure? So that's kind of the early childhood landscape, or the early child care landscape, and then we're really hoping to do that with all these different areas where we can lean in and look at different parts of the data and see, hey, what new data do we have? And we'll be updating it annually as data gets published, right? If we're using census data, we'll update it when that comes out. If there's any new data sources, we'll add to it. So that's kind of the vision behind it. So yeah, if anybody has any idea of other data sources, we are that might be new. We have scoured, and like I said, I've been at United Way doing this work for 10 years, so I feel like I have somewhat of a sense, but We also want to link to, I love the community profile that the city is doing, because again, it's such a great resource for data questions that we'll know we get. So we even just want to link to other pages so that if anybody is interested in data, they know where to find other data too. So yeah, I know that was short and sweet, but if,
thank you. Yeah. No, it's amazing. So much nuance to all of this, and when it comes to data, right, and like making sure we know what the numbers mean, right, versus assuming we know what they mean. So thanks, Sean, for bringing that up, and Allison for already having thought about how are we going to figure that out, right? And then again, just the historical data part, as I remember when I think you and Dan and others were working on that 211 sort of mapping of the 211 calls. And obviously we had the new call data, right? But it was kind of hard not having previous year's data, to actually know, well, how much higher is it, right, than last year? And so I know Dan had to go back a year. That's why it starts in 2019, not in 2020, because could you really please, Dan and United Way, go back one year so we can see, what is the pandemic, what has it really, how has it really affected things? And so I know it's a very time intensive and labor intensive, but thank you all for, again, kind of thinking through that and what the most efficient way of doing it. And certainly we understand that it takes time to do it right, you know what I mean? Because if you think through it ahead of time, it might save you a bunch of kind of legwork, on the front end, right, before you get too far into it and have to redo some things. But so exciting, so exciting. I'm so glad you all are doing that. And exciting time for our community in terms of early education and care. So again, there are, again, one of the things when we present the dashboard is we try to not always just look at the ones that are showing up in red, right, where we're doing worse, but also that there are success stories and there are things that are going right. Because I think I don't know if it's human nature or, we're problem solvers or whatever, we try to just go to, okay, we fix that. Let's, what other problem is there that we need to tackle, right? But I do think we need to celebrate when things are going well. And I think the last thing I'll share about the dashboard itself is, a lot of times when we present, and there's an issue that shows up as kind of trending in the wrong direction, or we're not on track to meet the goal. And early childhood, again, we have a very ambitious goal for early childhood, right? So we have a goal that we may be on track to meet, but not in 5 years, right? But a lot of times when we people are like, well, why if early childhood is such a big issue, Raul, how come CAN isn't working on it? It's like, well, we also do a scan of if people are working on that. Getting back to your not duplicating efforts statement, right, for developing this early childhood data hub, is that we if we see there's 10 groups that work on early childhood and there's a backbone, and United Way plays this role, and so does E3, right, in a variety of ways. And or in education, and you know what I mean, again, like E3 and other groups are working there. So we usually pick the ones where we're trending in the wrong direction, we're not meeting our goals, and nobody's working on them. So that's where we tend to do our work as CAN, and those are the most difficult spaces to be, and so I think with mental health, that's one where we've been working a lot in the last 3 years, really since the pandemic. And it's not to say that there isn't, folks working in that space, but whenever there's a mental health question, the answer is always talk to integral care, right? But with such a vast need that we have across the community and across every demographic, if you look at our demographic breakdowns for mental health in our dashboard, it doesn't matter which demographic it is, we're all doing worse with our mental health than we were doing 5 years ago. And it really hasn't gone down, right? It's at the most maybe plateaued, but there's still the need is so high. And we need more folks working in that space. And I think I think St. David's in their last appeal, right, had a section around mental health, a fun, grant appeal. So I think it's again, there's a lot that can be done with data, but sometimes again you have to dig much more deeply than we do with the dashboard to actually get into finding solutions. And that's why we so much value when we have all of our members of our dashboard steering committee at the table to sort of help to inform what is happening and where more help is needed. And I think that's something that we always try to be mindful of, since I think I mentioned earlier, we have an army of 3 people at CAN. So you got to be very strategic about how we deploy our time and effort. So, all right. Any last questions before I let Alison go? All right. We had some hearts. Yay. Hearts are good. All right. Well, thanks again, Alison and Dan, and all the folks over at United Way. I used to be on the leadership team for Success by Six, and Jalena's been on that for at least 5 years now, I think. Our program coordinator and operations coordinator. But I've been over not too far away working with Becca on the 2Gen Coalition for Economic Advancement. So, so kudos for doing that as well, right? All of these just so important for moving our community forward. All right, well, thank y'all. Y'all are troopers. You've been here a long time. And we're gonna transition over into the health sphere or arena. And I'm gonna invite Shirley with Austin Public Health to share a little bit about community health improvement plan and sort of where we are in the chat chip process, which it's an ongoing process that, it's not static in any way. It's always moving. And so I'm always very interested in sort of where we are and what comes next. And of course, how we can all help. So welcome, Shirley, and thanks for all you do as well. And you're still muted, so.
I am.
And I think you can share, hopefully.
Can you hear me?
Yes.
Okay, awesome. Yeah, I had my earphones and then they just started going, the battery was low, so I turned them off. So hopefully I can speak clearly and share it with you. So are you able to see my presentation?
I think it's waiting to pop up because it says it started sharing, but we don't see it yet. But it usually takes a few seconds. I'm still seeing a blank screen.
How about now? It says you sharing is paused. I think I need approval. I don't know.
Second, I think you should be able to share.
Maybe we can try again. Or we can put it up on our side.
It still says your screen sharing is paused. I don't know why. But I believe that you all might have my presentation.
Yeah,
Yes,
let me go
we do.
find it really quick, Shirley, and then I'll pop it up.
Yeah.
Yeah. So if you want to start with the introductory part, we'll get it.
Yeah, of course.
We'll get it up, and then we'll tell you when it's up.
Yeah, well, first of all, just thank you all to Raul, Carlos, and Jelena and all the folks on this call for inviting me, and I'm very honored just to be here and sharing this space with you all. As Raul said, my name is Shirley Aldana. I work for Austin Public Health. My pronouns are ella, she, hers, and sometimes I go by Cheryl. And I have been the planning coordinator just a little bit over a year here in Austin Public Health for the Austin Travis County Community Health Assessment and the Community Health Improvement Plan known as the ATC, Austin Travis County CHA-CHIP. And today's goal for me is to provide some insight into this important program, explain our process in gathering the data, sharing our findings, and discuss how these critical health indicators play a vital role in the social determinants of health and the overall well-being of our beloved city, city of Austin. So before I begin, and I know you can't see this, and hopefully you will get a copy of my slides at some
Okay.
point.
It's displaying already.
Oh,
So
it is great,
yeah,
wonderful. Okay.
we're on the cover slide. So tell us when you need us to move forward.
Yeah, please move on.
Okay.
Second slide.
Thank you.
Just before I really get into the chat chip, I want to take a moment to reflect on where we are or logging in from and why that matters. Wherever you are joining us from today, I want to take a moment to acknowledge that we are gathered on land with a long and rich history where I now call home is the home of the Taquana, Comanche, Lepan, Apache, and other native peoples who have cared for this region for millennia and generations. This acknowledgement is not at all political. It is a gesture of respect and gratitude for those who came before me. It reminds me that the work that we are rooted in is in a shared space with deep cultural legacy. As I mentioned, I am an immigrant. I was born and raised in Guatemala. And so this act of acknowledgement is very personal to me. It is a reminder that strong communities are built on recognition, respect, and relationships, values that cut across all backgrounds and beliefs. So what I wanted to point out in this slide, I have a couple of graphics there, is that some Native American communities refer to this continent as Turtle Island, which, as a undergrad in anthropology, this reflects the stories of creation, connection, and stewardship. I invite you to scan the QR code that I have printed here. And if you like to explore about the original inhabitants of the land that you live on, you learn, you play, and you work in. And also, you can always use it when you're visiting a part of the United States or even the world. So why does this matter right now at this moment in time, right? Especially here with city departments and some of our community partners like you all, because everything we build, whether it's infrastructure, health programs, public contracts, it starts with the people. And people thrive when they feel seen, respected, and included. I know I do. So our work here in public health is about ensuring access, opportunity, and well-being for everyone. That's not just a public health value. It is a Texan value. It is about neighbors helping neighbors and building strong, resilient communities. So today, let's not just talk about the data, about the systems and the strategies. Let's also consider how we engage with the people and places we serve with integrity, humility, and the commitment to continually improve together. Next slide. Just a quick overview. I will provide a quick overview of what the CHA chip. This will be a quick recap of the community health assessment known as the CHA and the community health improvement known as the CHIP. So I'm repeating that again. Some of you are probably very familiar. I know CAN ATX has been a partner of the CHA chip program at least since its beginning in 2011. But mostly, what I plan to do is how it aligns with your own efforts and how we can collaborate and achieve our mutual goals. Next slide, please. And again, just for those of you who may not be familiar with the community health assessment and the community health improvement plan, it is a cyclical process. It is a strategic opportunity to improve community health and foster impactful partnerships. It is part of the National Association of County and City Officials, known as NACCHO, We're also part of the Texas Association of County and City Officials, known as TACO, which serve several processes that can be used in Texas and local jurisdictions to improve public health. And so the community health plan also helps us clearly envision a healthier Austin. So you recall the Imagine Austin, which was kicked off in the early 2010s, 2011s. I know when I moved into Austin, it was how I became very engaged with Imagine Austin and integrating myself into living in this new community. And so it's also, the CHA chip was created to provide accreditation and funding. It keeps us accredited through the Public Health Association board and helps us to access funding through the accreditation. The accreditation process in Texas is a multi-year process that evaluates health departments against national standards. So you can say that it's part of our North Star or our best practice and effective practices around public health. It is about community engagement. It involves residents shaping our health priorities. It is focused on health equity, which helps us understand some of that granular data that you all have been talking about, and address those disparities. It is about taking action, which guides our leaders in setting data-driven health priorities. And it's about collaboration and strengthening the partners around public health, transportation, housing, development, regional health providers, nonprofits like yourselves, and many more. We collaborate with organizations like Ancession Seton, Central Health, Travis County Health and Human Services, UT Delft Medical Center, Central Texas Food Bank, among Integral Care, and St. David's Foundation. Most of these folks that are sitting in our steering and core coordinating committee are from these organizations. And I forgot to mention Integral Care. So I apologize for that if there's anyone here. But Mary Dodd and I believe Dr. Amanda Banks are serving. Dr. Banks will be serving in our steering committee, and Mary Dodd has been serving in our core coordinating committee. And she has been a phenomenal mentor to me throughout this last year as I get very familiar in the CHA chip. Our administrative team and our structure team is led by our program manager, Kojo Dodo, myself, in our consultant team, our human resources in action, and his name is Camarino Salazar. Great team that I work with. I'm really honored to be working with them. And so I mentioned we're under the leadership of our steering committee. They meet 4 times a year, and our core coordinating committee meets on a monthly basis. And together they ensure that we have a strong leadership and collaboration with the process of how we gather that data. Next slide, please. So to just take a little closer look, the CHA report is a dynamic, essential process, and like Raul mentioned earlier, it's not static. It spans between 3 to 5 years. Currently, we're in a 3-year cycle because our regional hospital partners are on a 3-year cycle because they have to answer through the IRS, just like we answered through our accreditation process through FOB, the Public Health Accreditation Board, and their process is 5 years. And so we're sort of jumping here. When I started last fall, we were just publishing our chip, and then immediately I had to start gathering reports for the CHA. So it's still, I'm in this, ongoing evolution of this cycle, and hopefully, through this process, um, we're able to for me, most importantly, as I began this presentation, it's about the relationship building. I see that many of you here could be potential partners moving forward. Particularly, I've heard a lot information within our core coordinating committee of asking questions about, hey, maternal and infant health outcomes, obesity and chronic health are issues that Austin Public Health is very, very involved in. And we work very closely with our EPI team, who provides some of the critical health indicators. In fact, they have co-written part of our maternal and infant health for our hopefully 2025 community health assessment report, which we hope will be published by the end of this month. And I think I'm jumping the gun a little bit. But as I was saying, the CHA report offers critical insights into critical health indicators, informing development of the community health improvement plan, it's the next cyclical step. It's called the CHIP. This initiative is not merely a standalone document. It embodies the continual commitment to collaboration, decisive action, and unwavering accountability and transparency. By engaging in this process, we can make meaningful strides towards improving the health and well-being of our communities. We really applied the, SMARTY goals, which are specific, measurable, achievable, relevant, time-bound, are inclusive and equitable. The select evidence-based interventions, policy, systems, environmental change are not just a program. It is, part of our core, belief on how we gather the data, how we analyze it through our partners, and how are we disseminating and sharing it with back to the community. We adopt and implement the CHIP. We publish the plan and share it widely with community partners, which I don't have it in this slide that you're seeing, but Delina will be sharing it with you later on. Please save the date for January 23, 2026. That is when we are going to do a public facing event and be sharing the data findings of our 2025 CHA report. It is an opportunity for partners to come together and help us develop the next CHIP priorities. And so, you all being part of that process will be monumental and really needed. And so going back into the 2024 Community Health Improvement Plan report, we developed work groups around those priority areas, which for that 2024 CHIP was informed by the 2022 community health assessment plan. And what that report indicated was that mental health, economic stability, neighborhood built environment were those priorities. And from those, they developed 5 objectives and goals within those 5 priority areas. And we have built for this year 3 core working groups around those 3 priority areas to really focus on the objectives and goals of each of that area. And so then, we're also working on those feedback loops, how we monitor, evaluate, and revise, and how we track progress with performance mentions and community indicators. And and report it back, as always. And I think I jumped a gun. So next slide, please. And so for this slide, I mentioned that we are about to publish our 2025 child report. That report is still being in the design development phase. The final draft or copy was approved by our steering committee on September the 29th. And we are still tweaking some updates on few chronic health outcomes and indicators based on the information that was published by our EPI team just recently, July 2025. And so our report, our first draft was using 2023 data, and our committee asked us to include that most recent data that we were not aware was out there. So anyway, just better community, sometimes it feels like we work in silos, and just being invited to this forum, this space today, it's an opportunity to just start, building those relationships again. But I digress. So once again, we really hope that by the end of this month, October 31st, we will have published our 2025 community health assessment. What can I tell you from what we have found? It is that, the HRI team, Camarino Salazar, did a really good job on clearly communicating the complex health data for Austin Travis County, and utilizing some of those primary data sources that we receive from St. David's Foundation, Ascension Seton, and Baylor Scott and White, and Integral Care, with some of the focus groups that they have conducted throughout this past year. They did really well in reflecting the voices of those underrepresented communities. And once again, going back to what Raul said, this is more just than a report. It's a tool that helps us understand where we're doing well, what we're falling short with, and where we can focus our next efforts. As I mentioned, the CHA lays the foundation for the CHIP by highlighting the key health needs and social factors impacting our community. And the QR code that you see there is access to our 2022 CHA report. Feel free to peruse through that. I also provided the QR code for our 2020, that's a mouthful, 2024 CHIP report. And some of, as I mentioned, that's where action happens. The CHIP was developed through a summit held in 2023, where they helped prioritize all the health indicators that were reported in the 2022 CHA. I just want to mention offhand that the 2025 community health assessment, when we were working with Camarino, they were finding over 130 community health critical health indicators, and narrowing it down is, a very difficult process as to, hey, we need to really discuss this, but what about this? And so we have also been talking about developing a dashboard, but with all the budget cuts that particularly Austin Public Health has received, that is currently on hold. So we are leaning on CAN ATX dashboard and the 911 and United Way as to getting that granular data as well. And I'm going to reach out to you in the near future to see how we can amplify those resources that you are providing for the community. But once again, as I was mentioned, it is just not check a box. It is reaching out to the Austin, Travis County organizations providing services and the critical health needs that were identified in the previous CHA in the CHIPS. And we're also established this year, we established CHIP work groups around those priority areas. I'm very honored that Carlos is sitting in our neighborhood built environment uh, work group, and Jelena in our mental health work group. So I'm just really thankful for Raul to being in the economic stability work group. So just thank you all for that partnership around those work groups. And then, again, the monitoring and evaluation, how are we tracking? So, part of this, of gathering the reliable population-wide indicators and social determinants of health, is to understand the impact, and it helps us spot those gaps and monitor trends and inform adjustments. Our data is mostly gathered from the U.S. Census, the county health rankings, DSHS, as well as the behavioral risk factor and surveillance systems known as the BRFSS. Vital statistics. And of course, our EPI team at Austin Public Health are amazing. Just this year, I've gotten to know Fernanda Santos and Emily Bradford, who I am building relationships with them and having them come into our monthly core coordinating committee meetings is going to be, critical in making sure that, we continue to monitor, what those health indicators are. We're transparent with the data that we're sharing with you all, how we're gathering it. So they are a valued partner. They're not a voting member of our committee, but they are committed to coming to our monthly and quarterly meetings to kind of, keep us accountable. We're working on and focusing on improving our regular feedback loops. As I mentioned, building those relationships with our EPI team is critical. We're also planned to hosting the community forums and listening sessions. We were not able to do it this year, one, because I was very new to my role. We were still working on doing an implementation plan for the chip, but just a little bit of lack of resources, right? And in building, having the capacity to work with those folks that are involved in our work groups, really it takes time. And so we're hoping that moving forward, we, kind of improve on having more ongoing type of events like this one, where we do these types of presentations on a regular basis.
And Shirley,
Yeah.
yeah, I think we're running out of time a little bit. So I
Okay.
think you gave a great overview of kind of the community health assessment, community health improvement plan, and
Sure.
then I think you mentioned the three current work groups, right? The mental health, neighborhood and built environment, and economic stability. So if
Yes.
folks are interested in that, I think we can put you in touch with Shirley to get connected. And I think you had a slide at the very end about other ways people could help.
Yeah, and if you just want to take me to the slide that is after the chat chip framework, it's the insights from the
From the
regional
partners.
health
Okay, go back
partners.
right there. Yeah, there you go.
Yeah. And
Yes.
so I just wanted to just share with you that this is information that'll be on the 2024 CHA. But these are, some of that primary data that we received from Baylor, Scott and White, St. David's Foundation, and Ascension. Those three regional partners we're really good about, getting those focus groups. St. David's calls them charlas or story circles. And you saw that there's still a lot of economic pressures, especially at the rising cost of childcare. I believe that we talked about that earlier. And while they did their own assessment separately with different regions, St. David's it really focused in the Austin Travis County in some of the partnering places where they have their regional hospitals at. Baylor Scott and White does a wider region. In Ascension also does, central health, but you see those connections, those regional needs are still, within, mental health and economic stability. So I just wanted to share that quickly. And then um, if we can just jump to that other slide before the thank you, the save. Oh, no, you don't have that. So just a call to action is that, we really hope that through this presentation, you are asking yourself, hey, how do I get involved with that? How do I serve in your core coordinating committee? How can I help in the work group? And, please feel free to reach out to me directly. And I'll be happy to provide information as to upcoming events, and in particularly our partner summit that will be held on January 23, 2026. And that's it for me. So I really appreciate it. And if you
Okay,
have
no,
a few
thank you.
minutes for questions, I'll be happy to answer them if I can.
Yeah, there's a lot, and then there's overlapping sort of implementation, right, and improvement with assessment work. So I know it's thanks for walking us through